balloon today. Very, very simple procedure. You saw this small one, deflated one that I showed you. So this one, I'm going to place it at the back of your throat, and then I'm going to give you a glass of water, and then I'm going to insert it, and then you're going to take the glass of water and you sip while I'm inserting it inside, and then it's going to go all the way in. Then I'm going to do an X-ray just to make sure that it's in place. Once we make sure it's in place, we're going to inflate it with 550 cc's of saline. And after that, we're going to take another X-ray to make sure it's in place. Then we're going to take the tube out, and that's it. So the whole process is about 20 minutes. Okay? Fantastic. We are ready. I'm going to give you this glass of water. And then I'm going to ask you to open your mouth really wide. I'm just going to place it at the back of your throat. And then as soon as it goes to the back, you just start to sip some water. Okay? If you feel that you want to vomit or anything, just try to control it for like 10 seconds until it passes. Okay. Brilliant. Take a couple of sips for now. Fantastic. Excellent. Open your mouth really wide and bring back a little bit. Excellent. Tongue out. Excellent. And very easy. No. Release it. Leave your tongue. Excellent. And drink. Very good. Going in. Perfect. Keep drinking. That's amazing. It's already in. Keep drinking. That's brilliant. Voila. Fantastic. Well done. Okay, I would like you to take some sparkling water now. Just a couple of sips. Well done.
Thank you.
You okay?
Yes.
All right. We'll leave that here. Then we're going to do the X-ray. Okay? If you can stand up with me. Excellent. Just come over here, please. And then put you back to this place. Yeah? And just move this with the left hand. X-ray says it's in place. Fantastic. What we're going to do now is we're going to start inflating the balloon and inserting 550 cc's of saline. So in a bit you will feel a little bit of cold fluid going through your throat down to the stomach, as if you're drinking, but you're actually not drinking. It's a refreshing feeling. Okay, Camila, X-ray is perfect. What I'm going to do is I'm going to pull that tube out. You feel a little bit of give, but that's it. If you feel tendency to vomit, please resist that just for 10 seconds until we do it, okay? Fantastic. That's it. Fantastic. And take some water.
Thank you.
All done.
Great. Thank you so much.
Literally 17 minutes.
Perfect.
Excellent. So now you're gonna meet my nutritionist. She's going to talk to you about everything, the diet, and she'll give you a scale and prepare you for everything. Okay?
Thank you very much.
Fantastic. And congratulations on your journey.
Thank you.
Excellent.